Good evening, everyone. Please excuse my voice. I'm a little bit under the weather. Um, but our topic today is shortages of nurses and acute shortages of primary care physicians. So one of the biggest challenges um, in the healthcare system today is the shortage of nurses and primary care physicians. But this problem affects every part of healthcare. It affects the hospitals, emergency rooms, primary care offices, rural communities. Um, Patients are oftentimes waiting a very long time for their appointments, and we have overcrowded emergency departments, which I see often. Um, and the healthcare professionals are facing really high levels of stress and burnout. And so, when we're assessing this issue, it's important to recognize that the shortage is not just because of one factor. So, the demand for healthcare continues to grow because our population is aging and more people are living with chronic disease, and that requires ongoing management. At the same time, um, many nurses and physicians are retiring, while there are fewer new professionals entering the workforce to replace them. Another major problem is that the healthcare system continues to rely on business models that were designed around physicians performing nearly every aspect of patient care. So this limits efficiency and prevents other qualified healthcare professionals from practicing to the full extent of their education and training. Now, looking deeper at the diagnosis, the root cause goes beyond simply not having enough nurses and doctors. The real issue is that healthcare delivery has not evolved to match today's needs. Um, And so, highly trained physicians often spend time managing routine or predictable conditions that could safely be handled by nurses, nurse practitioners, physician assistants, pharmacists, and things like that. So, as a result of that, the physicians get overwhelmed and they're not able to give patients care in a timely manner. At the same time, nurses are expected to manage increasing patient loads. I see that every day on shift. Documentation requirements, administrative responsibilities, and that just leads to burnout and higher turnover, which I also see often. Another root cause is the lack of investment in preventative care and chronic disease management. Many patients can't access primary care early, so they delay the treatment until obviously it becomes an emergency and they end up in an ER. And so then that increases ER visits, hospital admissions, healthcare costs rise. Um, and it's like it puts more pressure on an already limited workforce. Um, so, healthcare systems often focus on treating an illness rather than preventing it, which creates an endless cycle of the increasing demand. So, to address this problem, healthcare organizations must rethink how the care is delivered instead of just hiring more people. Um, and nurse practitioners and physicians assistants should be empowered to practice at the top of their license where state regulations allow, because research has consistently shown that they provide safe, high quality care for many primary care services. Healthcare organizations should also invest in technology that improves efficiency. So clinical decision support programs, electronic health records, and reducing documentation burdens. These technologies also improve communication, and then they reduce unnecessary visits from the patients, and they allow the patients to receive care closer to home. Um, Healthcare leaders must also focus on retaining the workforce that they already have with competitive compensation, flexible scheduling, mental health resources, supportive leadership, and that can reduce burnout and improve job satisfaction. So it's not one way to fix this problem, it's many ways. Um, the problem is not simply a lack of workers, but an outdated health delivery model. And that does not use every member of the healthcare team effectively. So the solution is to like redesign care by embracing technology, embracing disruptive innovation, making sure that we retain um, the workforce that's already there and making it comfortable in a healthy work environment for them to stay rather than hoping that we can fill their shoes if they leave. So that's all I have today. And that's it.